Hello, I'm Surbhi Sidana. I'm an assistant professor at Stanford University, and today I would be talking to you regarding my perspective on coming to the US for residency and fellowship. I would like to thank ASCO for this opportunity to speak with you. So, currently, I am an assistant professor in the Division of Blood and Marrow Transplantation and Cellular Therapy at Stanford University, and I have been here since 2019. I grew up in India, where I also went to medical school at University of Delhi, and then came to the United States for residency and fellowship. I did my residency at Cleveland Clinic in Cleveland, Ohio, and it was in internal medicine. And when I was doing residency, I really enjoyed my hematology oncology rotations and all the new research advances that were happening in hematology oncology, and that interested me in doing a fellowship in hematology oncology. I did my fellowship at Mayo Clinic in Rochester, Minnesota, where I also pursued some additional training in multiple myeloma and related disorders. And so I would like to talk to you in the next few slides about my journey of doing residency and fellowship and things that I have learned along the way. So when I decided to come to the US, it was mainly for greater opportunity, especially in research. And there were multiple steps to it. USMLEs is one of the first steps, and I felt that was one of the most straightforward steps. As medical students, we are used to taking exams multiple times, and while there are some nuances to it, it is one of the easier hurdles in the road. You know, then folks often asked about what about clinical rotations prior to residency? I feel that that is one of the harder hurdles to overcome. And the limitations there are the visa limitations in terms of visa sponsorships. And most institutions are not able to sponsor visas for such rotation. In my experience, it's easier to come to US as a medical student than after graduating medical school. So I would encourage you to ask. And often it is your peers who are a couple of years ahead of you that would know the best, and not someone who's several years or decades ahead of you, as things might change. So ask around. You have to do a lot of searching, and don't be shy to email people to ask if they are willing to take you know medical students or others for clinical rotations. In terms of doing research, well, research can be done at a couple of steps. Some folks do research prior to applying for residency, and others, do research after they've matched in residency to further, increase their academic pursuits. So prior to matching into residency, and this is something I did not pursue, there are various opportunities. Several mentors are looking for research trainees to join them for a year or two. And this can be both for lab-based research as well as clinical research. And there is really no data clearinghouse for, a list of opportunities that is out there. And so the way to find about these opportunities again is by emailing people and by word of mouth. So if there are people who have done research rotations, you can ask them if other labs or other mentors are taking on research trainees at the time, or maybe their lab or their mentor has an upcoming position. And if there are people you don't know, another opportunity is to email people. I would say don't email people without knowing anything about their research. Be thoughtful about it. Look at their research portfolio. See if that is something that interests you. See if they have trained people, like you before. And if they've taken medical students or, students right out of medical school as research trainees. And if they've done that in the past, it's more likely that they're open to that. And then email them with your specific interest in their research and how much time commitment you are able to give. Is it 3 months? Is it 6 months? Is it 12 months? Is it completely dedicated, or will you be doing something else on the side? Again, visa sponsorship is something that needs to be talked about. If they express an interest, that is something that needs to be discussed. And usually for research opportunities, visa sponsorship is easier than it is for clinical rotations. But again, be thoughtful about it, ask your peers, and if you're emailing, PIs or potential mentors, uh, do make sure that you've done your homework about the type of research they do and what you can offer and commit. The next thing, that a lot of folks ask, and in my experience of getting letters of recommendations, and I feel like this really is preceded by doing good work. If you're working with a mentor for 6 months or on a clinical rotation for 1 month, you really have to demonstrate your interest, your willingness, and your ability to, solve problems or take care of patients or learn about clinical issues and maybe do a teaching session or so. And that really precedes asking the letter writer. And if you're doing clinical rotations, I would say show up on time, show up early, show your enthusiasm, and maybe ask to give a presentation on a particular interesting case that you saw. Do your literature review, do a 10-15 minute presentation, and that gives your letter writer something to write about. For research, it's a little bit easier because you get that long-term relationship and they have supervised you for research, but really give it your best. Do things on time. When you say you'll do something, always do it. And ask for help. If you are stuck, don't be shy to ask your mentor for help. And when you go to ask for a letter of recommendation, I would say ask them if they can give you a strong letter. If they cannot give you a strong letter, they will tell you that. And I think then you're better off asking somebody else. And usually, both for residency and fellowship, you need 3 to 4 letters of recommendation. One of them is either coming from your dean's office or from your program director. And then you need to find 2 or 3 other people who can write you strong letters. And they can be both a combination of clinical letters and research letters of recommendation. So, it's been a decade. So I'm a little bit further along, from medical school, and now I'm in a faculty position. And I think there are some things that are constant. This is not easy. And I think don't be shy to ask for help. And I think what's more important than asking for help from someone very senior is to ask for help for someone who's just ahead of you, one step ahead. So if you're a medical student, maybe a first or second year resident. If you are a first year resident, maybe a third year resident who's just applying for fellowship or just matched. And if you started fellowship, maybe someone who's senior or just finished fellowship, because they are the ones that are closest to your struggles, and they will be able to, share their experience and how they have navigated the circumstances with you. And ask multiple people. Everybody has their own perspective. Your situation might not be the same as somebody else's situation. So ask multiple people. And if you ask, many people are willing to help. You have to be thoughtful. Everybody has limited time, but if you're setting up a meeting with someone who's 2 years ahead of you, maybe they can meet with you for 30 minutes and do your homework beforehand. What do you want to ask them? And maybe they've met with you once and they can meet with you a couple of months down the line. It does take a lot of effort. So I would say persist. And, if someone says no, don't be disheartened. That's really not a reflection on you. Everyone is really busy and they all have their own priorities. But, keep asking. Someone will have the time to help you. So don't be disheartened. Keep asking, keep looking for help. And what I found was that it's hardest to get your foot into the door. And at every step along the way, it gets easier as you've gotten time to prove yourself and show that you can work hard, you can deliver results. So for someone coming from outside of the United States, probably getting into residency or getting into that clinical rotation or a research opportunity probably is the hardest first step. And then every cumulative step becomes easier because you've demonstrated that you can do good work and that you can really, finish something that you've committed to. And as you go along this journey, I would say start with a broad interest. Initially you might be open to doing research in cardiology or oncology or different, areas. But once you've really, narrowed down your interest, say you're in residency, in the first year, take the opportunity to explore different, specialties, but then make up your mind and say, decide what you want to do fairly early on. Because if you decide fairly early on in residency, okay, this is something I want to do, and if you don't like it, you're always, welcome to change your mind. But the good consequence of making an early decision is that you get enough time to focus on it, do clinical rotations, do research, and really find those 2 or 3 people who can write you strong letters of recommendation that would allow you to get to the next step. And same thing for fellowship. If you want to go into academia in one particular, specialty, be it, hematology, and even within hematology, if it's lymphoma or myeloma, or maybe it's GI cancers in oncology, the earlier you decide, it will give you an opportunity and time to hone your craft, get enough publications in, and that way you'll be more competitive for job applications when the time comes along. And so I think that's just something people think that, oh, let me explore everything. Explore, but give yourself a definite time to decide that. And with the COVID pandemic, there've come a lot of challenges. We cannot really meet folks in person. There are no longer any meetings to go to where you could go and introduce yourself or meet, other peers, residents, or fellows. But it has also given, I think, new opportunities. And in a way, sometimes it's easier to connect and you're not limited to that particular meeting to connect with folks. Social media, gives us a lot of opportunities. So, things like people advertise research positions there. You can engage with residents. So if you're applying for residency, a lot of residency programs have their social media pages. And maybe you can engage with residents on social media or other fellows across the country on social media and start to build your peer network that way. Meetings are happening virtually. ASCO, ASH, AACR, other organizations all have, sessions for trainees. Take advantage of them. Try to connect with the people who have given these sessions and see, if there's questions, reach out to folks and connect with them. And again, it's a whole new world, but it does bring new opportunities to connect with people. And so with that, I would like to thank you for your attention. Feel free to reach out to me. This is my Twitter handle, and I wish you the best in your journey in getting residency, fellowship, or a new job. Thank you.